Hi, hi everyone. Hope all of you are fine. This is Iftikhar again. So this is exactly after 1 month. So today I have completed 1 month after my hair transplantation. So post surgery, I have spent like 30 days, and a lot of things happen in this last 30 days. That means I was in India, then I have came back to my workplace. I have joined office, how the people reacted, how everybody reacted, how I'm feeling right now, how the hair, transplanted hairs are growing. Are they growing? Are they there on my scalp? I'm going to actually answer all these questions today. So I didn't do any video in the last, I think 10 days or yeah, 7, 8 days or 10 days because I wanted to show the progress after 1 month. So today I'm completing 1 month after the surgery. So I thought of actually coming in front of the camera and show you the progress, how this hair transplant is going on. So if you guys want to look at the hair transplanted thing, that how is it actually developing, so look at my scalp. I'm just going to show my scalp for all of you. I hope you're having a good glance on the scalp area, on the transplanted area, on the crown area, and as well as on the back side. I hope you're able to find out the density of the hair which was there in the first couple of days, then 7 days or post 10 days, it's not there anymore. That means I am having the shock loss, and it's very alarming. It's very a tense moment for me because I can clearly remember after 2 weeks of transplantation, the first hair eventually came out from my scalp, and I just called my doctor. I just texted him saying that okay, this is the first hair I think got dislocated from my scalp. What should I do? So he just say that okay, it's a normal process. It doesn't have the root inside, so you can ignore that, and then continue whatever one you want to do. So it's a BU thing. Continue with all the BU things. So I tried to focus on, but every day the way the hairs are losing is very worrying. That means I'm a bit worried. But my doctor is saying that it's a normal process. I have done some researches as well, and I have figured out that it's a normal process. That means from second week onwards, from second week onwards means from 14 days till 1.5 month, that means till 45 or 60th day, you are going to actually lose almost all the hairs which have been transplanted. So if you excuse me, if you look at my scalp area, see the hairline was like this. Transplanted area, this area was really dense, but you can see that it's now almost, the hairs are not there. And if you look at the crown size which I have shown earlier, it's almost vacant. Yeah, so lots of hair have fallen in the past especially 2 weeks. All right, so I have lost approximately almost I guess 30-40% of the grafts, but I'm trying to actually restore the rest of the grafts by using some medicines. That means the doctor has actually told me to use minoxidil, which I'm using right now once a day, and yes, I'm taking the finasteride as well. Now, people will be worried about what is the side effect of the finasteride. Should I continue the finasteride or the minoxidil? Minoxidil I just have actually started from yesterday, but finasteride I am taking for the last 2 weeks. Okay, for all of your information, so far I'm fine. That means there's no side effect of the finasteride on me so far. And this thing that the side effect will be there if you take finasteride is like a myth. That means hardly, I think 0.001% people go have impact of having finasteride on a daily basis. So I think the benefits of having finasterides are more. So if you can take that to restore all of your hairs, restore the hairs that you used to have, and for the better growth of the transplanted hair, you should actually take the finasteride and minoxidil both together. Now, if you ask, that whether I have pain or any sort of complexity at this moment. No, no pain so far, but the skin on the crown, it's a bit, it's a bit, what should I say? It's a bit tight. It's a bit stretched. So sometimes I feel like it's getting dried up. Then I have to actually spray water on that my scalp. But other than that, no, no complexity. It's a natural process. I think the numbness is still a bit there. There's no pain. Sometimes it itches a bit, but not to that extent, tolerable. So for the itching or for any pain, I'm not taking any painkillers at this moment. And for normal lifestyle, I'm continuing with my job, having normal food, lying on bed normally, going to the sun or going to the other places, wearing a cap. That's quite fine, but I'm not actually wearing cap all the time. Once I'm actually going out in the morning outside, that means going out for a walk or going for a grocery, something like that. That time only I'm actually wearing a cap, but in office or in other places I'm not actually wearing any sort of thing on my head. I think, and that's all from my side. Keep praying on me, for me. I will come back after another 15 days probably. I'll do the next video and show you what is actually progressing, but this time is a bit worrying because most of the hairs are falling. So I'm keeping my fingers crossed and praying to Allah that I hope inshallah all the hairs will grow and I'll have 100% success rate. Thank you very much for watching the video, and keep subscribing, liking my video if you like that. And you can actually contact me, or you can send me the any sort of queries. If you want to have any clarification, just mail it to me. I'll reply you back. Thank you.